Not really to cause fear and panic to our listeners. I want you to break it down a little for us.
So, as a lady, if you are conversant with yourself, you know that um, there's a way your breast looks like in terms of presentation, size, in terms of even color. And the normal breast has a smooth outline. So if you are there and you are seeing changes in your breast, it could be a lump, it could be sometimes it may be even some small changes around even the skin. And that is a cause for you to seek attention, find out what is happening.
Okay.
Usually because sometimes even the breast cancer, as I said, is an abnormal growth. Some people may not even have any symptoms before they realize they have a full-blown breast cancer. So the normal tissues are in the breast. Once everything is fine, but all of a sudden you realize that you are feeling some changes, which is unusual.
Okay.
And once you are concerned, then you seek medical attention for it to be reviewed. So usually breast cancer, ladies, to me, it's one of the conditions you shouldn't even kill any woman, because the breasts are outside our bodies. We see them every day in and out. It's not a structure or an organ which is hidden inside your body that we may not know. For instance, if you compare from the main prostate, you don't know where it is. If you know it is, you can't even access it. But the breast is always visible, and therefore, if there are changes in it, as ladies or women, we should be concerned.
Okay, so let's talk about some things. How would I know, or what will prompt me that there is a possibility of breast cancer?
Yes, so the symptoms are very, very critical. In fact, to put on record, sometimes you may not even have any signs or symptoms at all. And there are times that you may have also symptoms. So as I said, the symptoms, we can usually group them into two. Those that you, the lady or the woman, you can control, and then or symptoms that you can be aware of, and there are those that you cannot be aware of, or you cannot do anything about it. So let's look at those ones that we can breast cancer symptoms that you can really do something about it. Okay. And sometimes so the symptoms can be a lump in your breast, a thickened area. Sometimes the color of your part of the skin of the breast may change. Sometimes you may see some dimpling. I said, and you see a breast is a round, nine-shaped structure. Sometimes you others say, I said there's a dimpling somewhere when you look in the mirror. Or sometimes you may see that there are some changes. One is either too big or too small than the other. Hitherto they were not this. So some time passed. So those are the signs. Sometimes you may also notice that the nipple and the central part either is curved somehow or it is getting missing. Usually it's pointing out nicely. Sometimes you can see that it's retracting. It is going inside. Okay. Sometimes it may be curved. Sometimes it may have some abnormal discharge around it, reddish discharge around it, or even when you press it, there may be some unusual secretion coming inside from the breast. These are some of the signs that may tell you that probably you may be having a condition with your breast which you need to seek attention.
Okay, so with everything you've said, it is very important for women to know their breast. You need to know your breast as a woman. So if you are listening to us and you don't know the size of your breast, how your breast appeared, if you are at home, just take off your shirts, your dresses, and then pay attention to your breast. You need to know how your breast looks like. Doc, let's talk about breast cancer epidemiology. Breast cancer epidemiology, that is economic burden of breast cancer.
Yes, so when you look at the cancers in women, the breast cancer is the leading cause of death among women when they come to cancer conditions in women. And it is the second most diagnosed cancer after skin cancer, which is after the skin cancer is more common among the Caucasian because of their skin color. But when it comes to women in general, whites tend to get more breast cancer than we, the blacks, more or less. And usually women tend to get breast cancer when they are about 50 going. It is much more common. But then between the ages of 35 to 45 or 52, that's the second range of women in terms of age group that are likely to get breast cancer. But when it comes to Ghana, since 2013 or thereabout, we consistently record close to 4,500 breast cancers annually, every year, among we Ghanaian population. And then the when it comes to the death of cancer, breast cancer, those who are diagnosed, you get about 47% of them who come to the hospitals at a very late stage. And if you take women in total in their lifetime, 1 out of 8 is likely to come up with breast cancer. So this is a bit of the burden of the disease in Ghana and then across the world. And in Ghana, of course, breast cancer is the leading malignancy you can find in women, as I've said. Unlike when you go to the other part of the world where women smoke more, for that places lung cancer precedes breast cancer in women. But when it comes in Ghana here, we know our lifestyle, we don't really smoke much, so breast cancer is the leading cause among women in Ghana here.
All right, let's talk about the causes, because there are a lot of causes flying around, a lot. And there is also another school of thought that we don't really know what actually causes breast cancer. How true is this?
So as I said, you can have some people who may not have any signs and symptoms. All of a sudden, they come out with the condition. And there are also some people who may also have signs. So usually, there are certain risk factors that may push a lady or someone to get more, be at higher odds of getting the breast cancer. For instance, the first thing you have to look at is that when it comes to even these risk factors, there are those that we can control and those that we cannot control. Especially, for instance, the things we can control is, let's say, your color, your race, your age. You understand? Those things you can't control them. And then your genetic constitution. Because if you take age, for instance, we are said 55 years and above, you're more at risk. Then there's second age group is about 35 to about 49 years or so. But then the race, we the black women are more likely to get breast cancer compared to the white before menopause. And then sometimes people may have personal history. Probably you may have had an episode of breast cancer in one breast. You are likely to predispose to getting another one in the other side. The other thing is that if there's a family history, let's say your daddy, your mommy or your sisters, that's your close relative, the first close relatives, were have been diagnosed with breast cancer, it's also likely that you may stand the odds. You're at higher risk of getting the breast cancer. And then there are certain genes, we call them the BRCA1 and 2 genes, which is the genes behind breast cancer. When they get mutated wrongly, they push you at a higher risk of getting breast cancer. And then a woman, your menstrual history. For instance, if you take a lady who menstruates very early, that's before age 12, and when you take the risk that you can control, you turn it around. Okay. So for instance, you need to be more active. Okay. Manage your weight. Means that you make sure you are within healthy weight. You are not overweight. You are not obese. You are eating right. You are avoiding alcohol. You are avoiding smoking. If you're a lady or a woman, you try and then probably start your family early. Try and then deliver that before 30 years. And then breastfeed to the long haul. Okay. Don't do let's say 2 months breastfeed or 3 months. At least do exclusive breastfeeding, and if possible up to 18 to 2 years. These are all protective for us. So you realize that nowadays we are getting more of these conditions, breast cancer. But in the long in the yesteryears, for instance, if you go to our villages and then our hamlets, where our mothers are having sometimes 6 to 9 children, it means that throughout their lifespan, they are breastfeeding most of the time, they are giving birth most of the time, and they hardly report these conditions. But here in this era where our ladies are staying much longer in school, okay, they are pursuing professional programs in life, and then they are delaying their family. These are the challenges we are seeing. They are giving birth less, they are breastfeeding less. You understand? So these activities are activities which are in your control, and when you do them in terms of ensuring that you are breastfeeding more, you are active, you are doing less alcohol, if possible avoid alcohol, because these things tend to put you at risk of breast cancer.
Doc, I said, then over, as a man now, you came for me.
Hey,
yeah, avoid alcohol. Do this. But Doc, talking about, giving birth more, looking at our economy and all that. Hey.
Yeah, this is what I was saying.
Hey. Okay, 18. But you made mention of being within the appropriate weight. I'm tempted to ask, what is the appropriate weight?
So usually there are two things. We use what we call the body mass index, BMI, and the normal range is from 18 to, at least let's say 24.9 or 25. Okay. But even nowadays, what is even more important is we call it the abdominal circumference. Your abdominal circumference gate.
Okay. What we call FUPA.
FUPA.
Yeah. Okay.
If your abdominal circumference, is greater than your waist circumference, then it increases your risk, or your also what we call oxidative stress. So your risk of getting certain conditions is higher.
No.
So because nowadays people are getting truncal obesity, where you see that their tummy or their middle side section is becoming bigger. Okay, you can see some women is so big that it can even it's like a mountain falling down. Those things are all risks in terms of increasing your risk of other conditions. We call them the non-communicable diseases. It could be hypertension, and even breast cancer also fall within that category, because they are part of a bigger metabolic syndrome. So let's do those ones, and then make sure we are fitter. Okay,
Auntie. We the people who belongs to the FUPA association, because I find myself there. We doc say we need to take our exercise and things very seriously, manage our diets and all that. One of these days we would invite Doc into the studio so that we have a conversation around the FUPA, because I need help. Okay. I really want to know what causes that. So one of these days we would invite you to the studio, and then we have a conversation around that. Let's now go to examining the breast. How I can examine the breast as a woman, what we call the self-examination.
So the self-breast examination, or breast self-examination, whichever way you call it, is a technique every woman should learn. Here we cannot demonstrate it, but the best place I would advise is that you just go to YouTube. A demonstration will be there for you, especially with the ladies. Get to know how to examine your breast. Basically, you should sometimes stand in front of a big mirror in a well-lit room. With a light, you stand, and then you expose or undress yourself to your waistline. Then you stand in front of the mirror, and then you observe your breast on your chest. First of all, when you do that, you keep your hands still by your side. You just observe the two. If you're a lady who is used to always examining and observing your breast, when there's a slight change, you will notice it. So you need to be conscious of it. So the best place you can see all these demonstrations, you can examine your breast standing half naked in the mirror, or when you're lying down, or even in your shower when you're showering. Those are opportunities every lady should seize to examine your breast. In examining your breast, what are you looking out for? You are looking out for changes. You are looking out for unusual lumps, or we call them some small solid masses within the breast. You are looking out for it. It could even pain. Okay, you are looking for changes in the skin color. You are looking out for changes around the nipple area. You are looking for changes around the black area. They call it the areola area. Okay, so any unusual change, once you know how your breast looks like, when there's a slight change, you see. Okay, and in examining your breast, okay, there's a way you go about it. The whole breast will be examined fully, and then we could have what you call the axillary tail, the tail of the breast, which goes right into your armpit. That area, you should also have to examine that portion. Okay, so go to YouTube. They have demonstrations there. So the ladies should be interested to be there. If the men are doing the YouTube, either they are going to do it so that they can help with their wife. If not, most of them are going to just side their eyes. But ladies, it is the breast is with us. So examine it, learn how to do it, and then also, I mean, as I said, the best times as a lady you should examine your breast is, I think, after your menses, because during menstruation the breast is a bit tender, it's a bit engorged, so it's not comfortable. But right after it, that's the best time, so that when there's any change, you see.
Okay. All right. So let's say I have done the examination and then I happen to find changes. I see changes. What do I do?
Okay, so once you see any change, there's no need to panic. It means that you are catching something very early. And with breast conditions, once it is seen early, it means that it can be managed completely.
Okay.
So you just have to then report to your doctor, okay, and the doctors or your health provider, healthcare provider. Then they will take a look at it, examine it, and then there are other tests that we'll do to find out what it is. Sometimes we'll do mammography. Mammography is just basically an X-ray of the breast. Sometimes they may do scans, like we do scan for pregnant mothers. All those things help us to find out what may be the problem. And then sometimes we do biopsies too. I mean, there are a lot of things that can be done.
Okay.
And once this is done, the solution can be always be arrived at. The best thing is that, or we should take notice that once you see any changes and it's noticed early, breast cancer is very curable. And I've met countless clients who have, through early detection, and they are going about their normal duties, and they are living their full life. So please, once you see any changes, there's no need to panic. Just see your healthcare professional.
Okay. George, before I let go of you, you made mention of the fact that you've had clients and all that. What are some of the, myths surrounding, like the biggest ones surrounding breast cancer?
So the myths, there are a lot. In fact, I don't know if because of our cultural upbringing, a lot of superstitions around it, and sometimes the wrong teachings to have gone on. For instance, our traditional healers and other places, they say you have a breast condition, a knife shouldn't touch you, that kind of thing. So those things have fell into people's mind, and it puts fear in them. And for instance, breast cancer, sometimes they say it's a what do you call it? It's a curse or something like that. Those things are all not true. As I said, we the ladies or we women, we stand at a far advantage, because you see the breast is outside, it's visible. Once there are any changes, we will see it early. So breast cancer or breast diseases shouldn't trouble our women. Okay, unlike the men. For instance, if we compare ourselves in the area of prostate cancer, there's no man who can stand in front of a mirror and watch his or his prostate. It's not possible. But we the ladies, it is visible. You can even teach your man, your better half, also to examine it for you. And the other myth is that if because we say breastfeeding is something that is encouraged, it doesn't mean that if you have a man and then for 24/7 he is sucking your breast, you will not get breast, or reduces your odds of getting breast cancer. It's not true. We are talking of breastfeeding. It's active breastfeeding. and not the romantic breast sucking that we're talking about. But then our men too, your lady, you should be able to also be concerned if you are seeing any changes in your wife's or your lady's breast. You should help her to seek attention, and then everyone will be okay.
All right, thank you very much, Doc. Before you go, any takeaways, anything you want to tell our listeners?
So usually, what I say breast cancer is with us, but it's preventable, it's curable. Okay, the power lies in your hands as a lady to know yourself, and then do regular breast examination. Don't wait till only October. Any time you undress before the mirror, you are bathing, you are taking a shower, it's an opportunity to examine your breast. And once you see any changes, seek early attention, and you'll be healthy. Thank you very much.
Thank you too very much, Doctor. So that was Dr. Frank Ewusi Brown, Medical Director